There are calls for a more effective advertising campaign that goes beyond presenting facts that inform, to use of emotion to change people's behavior to overcome apparent lack of trust in the government. On May 23, 2021, Health Minister Greg Hunt reiterated that a sufficient supply of Pfizer is expected to begin arriving in October, with AMA President Omar Khorshid adding this promised supply means everyone who wanted it could have both doses by Christmas of 2021. Nevertheless, government, AMA and ATAGI advice remains for everyone to vaccinate as soon as possible and not to wait, because the potentially future risk of community transmission in Australia remains a possibility, and which until June 17, 2021 over 9 million Australian residents over 50 had to weigh against the tiny risk of death associated with the AstraZeneca vaccine that, according to best data available at the time, was probable to manifest for approximately 9 to 14 Australians, or approximately 19 Australians according to EMA data. Health Minister Greg Hunt said on June 17, 2021 that the recommended advice from ATAGI was that the Oxford AstraZeneca vaccine only be administered to people aged 60 years and over. The advice also stated that second doses of the Oxford AstraZeneca are still recommended for those under 60 years of age. Everyone under 60 will be offered the Pfizer vaccine. Hunt stated that about 815,000 Australians between ages 50 and 59 had already received a first dose of the AstraZeneca vaccine, with Pfizer now available to the approximately 2.1 million remaining Australians in that age group. In a survey conducted in June 2021, about 15% of respondents not yet vaccinated identified wanting a different vaccine to what was available to them as a factor holding them back from getting vaccinated. Since only 18 to 39 and 60-plus-year-olds are eligible for one vaccine, i.e., AstraZeneca, but not the other, i.e., Pfizer-BioNTech, making Pfizer-BioNTech available to everyone would obviate one factor holding back vaccination uptake.